It's Dr. Jen. Welcome back to the Integrative Health Podcast with Dr. Jen. I'm Dr. Jen, and today we'll be uncovering a surprising connection, how your thyroid could be the key to a healthier heart. Joining us is America's Healthy Heart Doc, Dr. Joel Kahn, one of the top cardiologists and a passionate advocate for plant-based nutrition. While we disagree on some of the nutrition aspects, Dr. Kahn, after decades of treating acute heart attacks, he transformed his approach, focusing on prevention through holistic cardiology. From groundbreaking diagnostic tools to the transformative power of nutrition, he's on a mission to help your heart thrive. Could your thyroid be holding the secret weapon for better heart health? Let's dive into the discussion. Hello, and today we have Dr. Joel Kahn. He is an expert in all things cardiology. He has been on Dr. Phil, The Doctor Show, Dr. Oz, Larry King, Joe Rogan, so many things because he knows what he's doing. So of course we would have him here to talk about the heart and the thyroid, what you need to know. So Dr. Kahn, welcome. We're so excited to have you here. Tell us a little bit about yourself and how you got to be so amazing with cardiology.
Oh, you're so kind, but I'm excited too. It's a great topic. Your summit is great information. I'm in suburban Detroit, and people might say, why don't you live in San Diego or Costa Rica like everybody else? But I love it here. My family's here, and I trained at the University of Michigan. And at age 18, I adopted a plant-based diet at University of Michigan. You might call that vegan. So I had a strong interest in nutrition for now over 45, 46 years. I'm in my approaching mid-60s. Amazing to say that, but I got my first email letter from Medicare recently. Said, too soon, don't want it. But anyways, and as I did standard cardiology, I want your heart attack, I want to put a stent in your artery, I would talk to people about nutrition. And out of that, after many years of really hardcore cardiology in suburban Detroit and Ann Arbor, I went back and did my full integrative medicine training, functional medicine training. And about 8 years ago said, you know what, it's exciting, it's scary, it's frightening to make changes, but I'm going to completely turn my life upside down. And it's been a delightful path. So we spend a lot of time with people at the root cause, the functional medicine cause, from sleep to nutrition to fitness to dental health. Oh, I just had a talked to a patient literally 5 minutes ago who hasn't been to the dentist in 10 years. Oh my God. His wife had set me up to make sure I knew to ask him about it, but I ask everybody about it. And we spent a lot of time on the thyroid because it's so critical in metabolism in general and cardiac health particularly.
Yeah, that's awesome. And I'm so glad that you did something scary and now you're helping tons of people. I know I can refer patients to you, which is nice because you're just like an hour away from where my office is. So I'm so great that I have you as an option. So let's talk about the thyroid and our heart health. So how does the thyroid hormone impact our heart health? Some people might think they're separate because they go to a cardiologist and they go to an endocrinologist, but as we know with integrative and functional medicine, they're all connected.
Yeah. Well, we actually know there are actually thyroid receptors on the heart and on the heart muscle cells and on blood vessels that supply the heart. The clearest connection and when you have a healthy thyroid, we call that euthyroid. There's the pronoun for the thyroid, EU. That's, full evaluation, and your thyroid is making just the right balance of thyroid hormone, the free T3s and the free T4s. You have a wonderful symphony going on, but there is that potential to have overactive thyroid, the hyperthyroid. And that's pretty uncommon in your practice, in my practice. Usually requires some referral out to an endocrinologist or a thyroidologist. But an overactive thyroid just whips on that poor heart. Most people with an overactive thyroid, their energy's low. They may have some tremor. They may have a progressively higher heart rate because of all that excess thyroid hormone. They may start to lose some weight and sweat a little. Their eyes may start to bug out a little bit, called Graves' eye disease. It can be quite serious if it's autoimmune hyperthyroidism, Graves' disease, GRAVE'. And interestingly, when you're hyperthyroid, your cholesterol falls. So maybe transiently, temporarily, your risk of heart attack may drop a little bit. But that can create a whole spectrum of heart diseases in and of itself, because really we're whipping. Just think of, giving yourself adrenaline day after day after day. Maybe you have an EpiPen and you eat some nuts accidentally and you got to take an EpiPen and you feel better, but for a little while your heart's racing and you're all jazzed up. Think about, 24 hours a day, you've got a thyroid, a nodule, or the entire gland making too much thyroid hormone and really whipping not just cardiac, but specifically because it can stimulate cardiac muscle cells and all. There can be some real dangerous things that happen. Of course, just the heart rate can go up. And over time, if you put your foot on your accelerator in your car and you've always got to pedal to the metal, you might do yourself some damage. If we talk about cars anymore, I'm going to embarrass myself, even though I'm from Detroit, because I can't tell a carburetor from a flux capacitor. But anyways, there's no carburetors anymore. I do know that. Just pedal to the metal if your thyroid is overactive and your heart rate's 90, 95, 98, 102, 104. That's why one of the mainstays of the early therapy of overactive hyperthyroidism is a beta blocker, a temporary way to protect the heart from excessive adrenaline and high heart rate and all. There's a really interesting and unusual but well-known syndrome. Syndrome means we understand some of it, not all of it. But some people present in congestive heart failure. They're short of breath, their ankles are swollen, they've gained some water weight, they're breathless, just walking to the bathroom and taking a shower. Of course, these are pretty marked symptoms. And in the evaluation, maybe as an outpatient, maybe as an inpatient, we find out that their thyroid hormones are out of whack, they're hyperthyroid. And if we do that simple test that we do in anybody that's short of breath called an ultrasound of the heart, also known as an echocardiogram, we sometimes find a weak heart. So there is and that's a fancy word, but that's called a cardiomyopathy, a weak heart. And there is a cardiomyopathy of hyperthyroidism, and it can be quite serious. You can have rather marked congestive heart failure and develop hyperthyroidism. And the good news is, there's going to take weeks to months of instituting a variety of therapies focused at the thyroid, from the beta blocker to other drugs that block the production of the thyroid hormones. Maybe ultimately a radiation ablation or a surgery to correct the nodule in the thyroid or the diffusely diseased gland. But generally, when you have a weak heart, you really worry about the long run, and you don't generally expect the heart to recover completely. In hyperthyroid cardiomyopathy, hyperthyroid floppy weak heart, it can recover fully, completely, and entirely. So we always will be checking, even though it's unusual, but thyroid hormone for thyroid excess in hyperthyroidism. Even we create hyperthyroidism in our cardiology practice on occasion. Probably everybody knows, and I'm sure from the other excellent segments on this summit, that iodine has a lot to do with thyroid hormone production. And there is a particular cardiac drug we used a lot 20 years ago. We used less, but my mama's on it, so we still use it sometimes. And I'm careful with my mama at age 90, but she's on a very low dose. It's called amiodarone, and AM, then IOD. What's the IOD? Iodine. The structure of this heart rhythm medication used for atrial fibrillation is built on an iodine molecule. And it can be a problem because in the process of, even at low doses, using amiodarone, or used to have a name brand, Cordarone, and it's been around for 40 years at least, in the process of getting control of medium or serious heart rhythm problems like atrial fibrillation or ventricular tachycardia, you're flooding the patient with gobs of iodine, and their thyroid on occasion will become overactive. So we're treating one problem, the heart rhythm problem, maybe atrial fibrillation, and we have the potential for creating a completely different and serious heart problem, hyperthyroid state, and maybe even with a cardiomyopathy. So we got to, always when we use medication, be so careful that we're not, paying Peter to rob Paul, I think is the statement, or paying Paul to rob Peter, but getting one gain and offsetting another. And that's just, a brief overview of the overactive thyroid syndrome, the hyperthyroid syndrome, the Graves' disease, the toxic nodule that's just putting out hormone, putting out hormone, putting out hormone. That's why certainly in my clinic, I'm sure in your clinic and most functional medicine clinics, a thorough thyroid panel is pretty much a basic, just like a blood sodium and potassium level, you're going to get a pretty thorough thyroid panel. And, I do find a lot of thyroid disease that others don't find. And some of it is the fancy word in medicine. If we cause disease, we call it iatrogenic. Sometimes we're doing it. We're giving so much iodine drops, iodine supplements, or medications that we trigger hyperthyroidism. But the good news is the outcome is usually pretty damn good.
Yeah. And it's interesting because with iodine, it's like there's a sweet spot. It's kind of like Goldilocks, and it's hard to test for too. So with iodine, yeah, you don't want to give too much. You don't want to get too little. You need that sweet spot. But definitely when medications like amiodarone, you have to know if you have a loved one on that, they need to have their thyroid be monitored during their treatment on that.
Right. We have a few really competent functional medicine doctors around the Detroit area, but a few of them just love iodine for a variety. Thyroid cysts, breast cysts, some cardiac conditions. That's a alternative approach. You're not going to find most conventional doctors treating anything with iodine. And some of them are using really big doses. And when I want to know an iodine level, I do a urinary iodine. You can do it just on a spot urine. You could do a 24-hour urine, but I'm told that the spot urine is pretty accurate. And these people come back with levels that are 500 times the reported upper limit. And I give a call to my colleagues and they tell me not to worry about it. But I'm sure once in a while it's got to trigger hyperthyroidism, just like this medication built around an iodine molecule can trigger hyperthyroidism. So we don't want to do harm. We want balance. I agree. And the balance can be tricky.
Yeah. And with that balance, like you said, sometimes we cause things as doctors, even though we don't mean to. So with patients, if they go on thyroid meds, one thing I do tell them, especially if I'm starting a T3 medication, that watch out if you have palpitations,
right,
or anything going on like that, we got to recheck your levels, come down on the dose, because medications affect everyone differently. So
yeah,
I don't know
agree.
if you see that from time to time.
Yeah, and I left a little piece of the story out, but it's too important not to just double back while we're talking about overactive thyroid, hyperthyroid, is that there's this insanely common heart rhythm that dominates standard cardiology and also dominates a lot of integrative cardiology practice, and that is atrial fibrillation. I said that word when I was referencing my sweet mama. And if you overdose a thyroid supplement, whether it's a pharmacy or a natural compound one, you can really, because of this finding that there's thyroid receptors on the heart muscle throughout the heart, top of the heart, bottom of the heart, you can promote somebody flipping into a rapid, irregular, uncomfortable arrhythmia or rhythm problem called atrial fibrillation. And, very often that requires emergency room visits and evaluation, or just makes them very anxious and upset while it's happening. And you find out, oh, my TSH is so low, I can't measure it. And my free T3 is sky high, or reverse T3 is sky high. So you're right. Sweet spot is obviously the goal. It's not so easy, but to precipitate atrial fibrillation is messing up a patient's, homeostasis. So we want to try and avoid that, practitioners, for sure.
Yeah, absolutely. The other cases of hyperthyroid that I find is interesting is when they get the subacute thyroid, thyroiditis from a virus. So I had a patient that she went to the ER and they just ran a TSH. They didn't check a free T4 and a free T3, and her free T3 was like close to 10, and she had COVID, and she got that subacute thyroiditis kind of kicked in, and
Wow.
she leveled out, and she was fine, but it was crazy. Her neck just hurt her and her back hurt her, and then she was dropping weight. She didn't really have palpitations though, but if it would have went on and we wouldn't have intervened, she might have. So it's really important to make sure that you do get a full picture, because just the TSH, it might be more subtle. And I know you see probably that a lot in your
Right.
office, because you're looking for the optimal ranges and not just the standard ranges.
For sure. For sure. For sure. No, those are good points. And, we just spent 10, 15 minutes talking about a relatively uncommon medical condition, hyperthyroidism. I'll flip over. It's okay with you, much more common, much more involved in the standard practice of medicine and the integrated practice, functional practice, is hypo or underactive thyroid, where your receptors on your heart are not getting stimulated to the normal amount. And of course, there's a whole variety of reasons. I have a practice that doesn't require patients to be vegan, also known as whole food plant-based. But because I am, many of them are, and they come to me partly for that and guidance. I want to be the healthy, whole food, plant-based vegan eater. I don't want to be a train wreck like I once in a while see on Twitter or Instagram or documentaries and all. And, one potential deficiency, this is not a startling statement. I don't think there's a perfect diet out there, because they all could induce some nutritional weak spots. But one of the weak spots in a 100% all plant-based diet is that iodine intake can be low. And we just talked about iodine intake too high, and we talked about sweet spots in the middle, but iodine intake can be too low. There's scientific literature on that in somebody that is eating whole food plant-based. There are some, easy fixes without supplements. People that put kelp flakes on food. I'm one of them. I find beautiful, mixed spice mixes, organic ones that you can buy at spice stores or online that are built on kelp flakes. And kelp is pretty tasty. It doesn't taste seaweedy, fishy, and it has a lot of iodine in it. And then you can check that urine test to see if you're in the sweet spot. Some people like to eat seaweed at sushi restaurants. I go to sushi restaurants. I have the pickled radish roll or the natto roll or the organic tofu roll or cucumber roll or something, but I'll often have a nice seaweed salad. That's a good way to get a little iodine. More and more multivites, and there are multivites geared for the whole food plant-based community, have identified iodine as worth putting in a multivite. And it's not in all multivites, but just to give a shout out, there's a Dr. Furman multivitamin that has iodine. I use one called Complement Essentials that has 8 components. I use it for myself, I use it for my patients, but I think there's 8 milligrams of iodine a day, which is just enough to make sure you're not missing out on that important nutrient and starve your thyroid and make it hypothyroid potentially. There's the rumor, I don't know how you feel about this, that the cruciferous vegetables, particularly the awful kale. I don't think kale's awful, but some people paint it as an awful, awful green vegetable. I mean, if you massage it enough and cook it properly, it can be delicious. It's not so attractive as raw. I'll eat raw spinach now and then, and arugula raw all the time. I don't eat much raw kale. Last time I looked in the medical literature, there was very few actually documented case reports that cruciferous vegetables can be goitrogens, can produce hypothyroidism or thyroid nodules by interfering with thyroid metabolism. It may happen subtly, but to actually produce disease. The case report I remember was a Oriental lady eating like 5 pounds of bok choy a day. Not too many of us are eating 5 pounds of any green vegetable a day. Chris Hemsworth did. Chris Hemsworth was eating 5 pounds of spinach a day, and he got kidney stones from all the oxalates. So anybody listening, plant-based diets are super healthy, but rotate, eat arugula, eat some bok choy, eat some spinach, eat some romaine, even, rare iceberg. I don't eat much iceberg.
Yeah, I agree with you, Dr. Kahn, with the cruciferous vegetables. That's kind of blown out of proportion unless you're eating breakfast, lunch, and dinner and snacks and going out of your way. And also, yes, Popeye, he had kidney stones. I mean, Popeye, from all the oxalates from the spinach, whew. But I didn't know that about Chris Elmsworth. So
it was a
why would
pretty
he
big
do
deal
that?
in the news he was plant-based vegan, and he left the movement. And whenever a media person leaves anything, it makes news. Like he has his PhD in nutrition. Anybody of reasonable value would have said, buddy, when you're making those morning smoothies, just rotate around a little bit, put some chlorella in there, put some spirulina in there, but just don't focus on mono foods. We like variety, of color, and even within a color, variety of sources of that color, without making it too tedious. I mean, it doesn't have to be painting by the brush with 30 different colors every day. But next week, go to the grocery store and try a new one. Try dandelion greens, for God's sakes, or kohlrabi, or broccolini, or something a little different. Good stuff. So I off a little bit. So vegans, iodine, multivitamins, or seaweed, or nori rolls, or a little kelp flakes. But in general, just talking about the importance, hypothyroidism, from a variety of causes, slows down the metabolism. People are tired. People's skin is dry. Their hair is brittle and dry, maybe falling out. Temperature may drop a bit. They tend to have a lower heart rate if it's really profound, opposite, of course, of the hyperthyroidism. Not particularly prone to the atrial fibrillation. But just like the real severe hyperthyroidism could trigger, rarely, this congestive heart failure, cardiomyopathy, weak heart, a really severe case of hypothyroidism, somebody they've had their thyroid out, they've had a thyroidectomy or thyroid ablation, and they stopped their meds. I'm sick and tired, or I forgot to pick it up for 6 months, and they get severely hypothyroid. It can impact cardiac function, even to the point of congestive heart failure. Again, good news, largely reversible. They may get some fluid around their heart, fluid around their lungs. That's called a pericardial effusion and a pleural effusion. The heart rate may be in the 40s. If you do an ultrasound, again, an echo test, the heart function may be at the low end of normal, or even below normal. And an interesting thing and important, that's why you want this sweet spot you mentioned, and I'm going to use that word again, is cholesterol is very much tied to thyroid metabolism. And in hyperthyroidism, what we talked about at the beginning, cholesterol tends to fall till you bring them back to normal thyroid. And that's not necessarily a bad thing. But the worrisome thing is, in hypothyroidism, cholesterol can skyrocket up, and you can see cholesterols of 300 plus, which for a week or two, it may not be dangerous, but month after month, you might be, promoting your already somewhat diseased heart arteries if you've not had the healthiest of genetics and lifestyle. So, again, just like anybody with atrial fibrillation is going to get a full thyroid panel, or and all, but anybody with a high cholesterol should get a full thyroid panel, because the treatment may not have to be dietary tweaks and cholesterol medication or cholesterol supplements. It may just be replacing their iodine, supplementing their thyroid with natural compounded supplements, and you just see the cholesterol fall dramatically. I've seen some big O cases of that, for sure.
And I think that's a really important point to make, is if your LDL is high, your cholesterol, the bad cholesterol, if something's off, before you get thrown on a statin, if someone's out there and they just have a primary care doctor for right now, make sure they get a full thyroid panel. Make sure you ask for it, and not just a TSH, at bare minimum, a free T4, free T3, and TSH. So that way you're not chasing this cholesterol number when you're not finding out the root cause, which, could be your thyroid.
And since you might have an audience for your wonderful summit that has a female predominance, because when we talk about thyroid disease, that is just the demographic that it concentrates in. I just want to run with what you said for a minute, even though it's not directly thyroid, but it's so much what I do in my clinic. Mrs. Cole, you're going to need to start this low dose cholesterol medicine called Lipitor because your cholesterol is 265 and, it's going to put you at risk. Well, step one, you just mentioned, it doesn't matter if you're seeing a functional medicine practitioner, a gynecologist, endocrinologist, internist, family doc, check the thyroid complete, check the liver health, check your blood sugar. I mean, if you're pre-diabetic, you want to focus on that and see if you change your diet, lose the weight, start to exercise, take some berberine or bergamot or some natural supplement, bitter melon, and get your blood sugar down, your cholesterol will typically fall and you don't need the medicine. So those are called secondary causes of cholesterol. And before you take a med for life, with rare exception, you want to go through that list. And certainly thyroid is a big part of it, but it's not the only one. Excessive alcohol intake, excessive, dietary indiscretions, of course. You're just addicted to Frappuccinos and Mountain Dews and Tim Horton donuts. I mean, don't take Lipitor. Take all those beautiful fruits and vegetables we mentioned. But the new really endorsed approach to this big subset of women, and I say that because I see it in women more, women that are seemingly at low risk for heart attack and stroke, but their numbers on the paper are a little bit worrisome, is there's a simple test called a heart calcium CT scan. Not talking to the 32-year-old, but the 48-year-old, the 51-year-old, the 46-year-old, that's been told you need to start cholesterol medicine. I'm really uncomfortable with your cholesterol numbers. Your mother had a stroke at age 79. I'm worried about you. The current approach is that there's this CT scan. You can get at almost any hospital in the United States and even outside the United States. Takes about 10 seconds. You just lie down, hold your breath, go home, no IV, no injection. The radiation exposure can be less than a mammogram. So that's considered low. And the newer, better of a CT scanner you're having it done at, the lower the radiation will be, but nothing injected. And there's something called a heart calcium score. And if it comes back 0, it was suggested way back in the 2000s that people with a heart CT scan of 0 don't benefit from, have more risk from than benefit from Lipitor, Crestor, and the statin cholesterol medicines. Of course, your doctor might start you super low, but the data was, we don't think we need this at all. And as the science progressed, and I adopted that philosophy, I take women off of statins if they go get this CT scan. Typically it costs about $75 to $100, $125 to get the CT scan. And you do it once, and if you're a good 0 perfect artery result, big celebration, do it again in about 7-8 years, something like that. So the radiation is very low and the cost is very low. And I take women off statins. But in 2019, the American Heart Association looked at all the data and said, we actually agree. If you've been told you need cholesterol medicine and your heart calcium CT scan is done and it's 0, we can't find any evidence you really benefit from Lipitor, Crestor. The Canadian Heart Association came on board. And just in the past couple of weeks in Denmark, they did a massive study and they segregated out 24,000 people. I think it was 10,000 that had a calcium score of 0, but big numbers. And they looked over up to 4 years and then another subset, 16 years. If you were 0, even if your cholesterol was really high, you did not have a risk identified of strokes and heart attacks. So I think cholesterol is always important, but what's more important is, are your arteries clean or not? And if your arteries are clean, you got time to work on your diet, get your thyroid balance, get your iodine level balance, get your, gym membership to Orange Theory in place, get the weight under control, do the fasting mimicking diet, do something, but you don't need to take a prescription for life. So many of the women listening to this may well have been told, if your cholesterol doesn't come down, you need cholesterol medicine for life. First question is, can I get my thyroid checked and my liver checked and my blood sugar checked and my iodine level checked? And can I work on my diet and all? But can I get a prescription and I'll go pay $100 at the hospital to get a heart calcium CT scan? It's like Vegas, baby. If you come back as 0, you scream and shout in joy, and you do that again in about 5 to 7 years.
I love that you went on that tangent because it is so important, because these statins, they have side effects. Many people are not told they deplete CoQ10. So then they're taking a statin and their CoQ10 is getting depleted. So I think that this is really important information that you share, because it, like you said, it's quick and easy, not a lot of radiation. I know when I need to get to that age where I want to look at my coronary calcium score, I will get one. So very great preventative medicine, which,
Right.
we want to stop people before they have a heart attack. And,
For
we
sure.
haven't, and, the statins don't really do it. But yes, lifestyle is so important. And even for the thyroid, making sure your blood sugar levels are balanced and, checking the liver enzymes, like you said, to make sure there isn't fatty liver, which is another early indication of blood sugar issues. So it's just the whole body. And that's why this is so cool. It's all connected. So I love that you educate your patients, on nutrition. And you were like the OG of eating vegan, it seems like, almost, because you said in med school you started that.
Age 18, 45, 46 years ago. So have literally been completely committed to that and have benefited from it. But I've seen patients not do well with it, and I've got to coach them. And and I don't apologize for taking a multivitamin with some key supplements in it. Usually I take algae omega-3 versus fish oil based omega-3, but I don't want my brain rotting. I don't want my thyroid rotting. And I'm not going to call a vegan diet a natural diet, but it's a point of decision to make in 2023 if it's may not be the best thing for you. So it worked out pretty well for me and a whole lot of my patients. Certainly a heart-friendly diet.
Yeah, and definitely not every diet is going to fit every person perfectly, but like you said, the diet has to be done correctly. So anything could be taken extreme. Like I remember reading an article about a guy that just ate bacon for 30 days straight and he lost weight and all this stuff. And so, that's too extreme. So I think
Chemotherapy every day and lose weight and all. Yeah,
right.
little tip you take before a meal, you eat a little apple. There's certain foods out there that give you a negative calorie deficit. You eat 100-calorie apple about half an hour before dinner. On average, people eat 200 calories less at dinner because they've got a feeling of satiety. So yeah, the other one I just happened to post on social media. You take a glass of water with a teaspoon of chia seeds, stir it up and wait a couple minutes and drink it. I'm going to a party and I just know I'm not going to have self-control. I'm going to overeat. It really fills your stomach up with great nutrition because chia seeds are great in omega-3 and fiber, but it gives you a nice feeling of satiety. I mean, everybody's injecting themselves now with these, genuine indication or somewhat shady indications for the weight loss drugs. There are some natural foods you can do it with too, and get yourself, to a healthier weight without any weight shaming going on here. No weight shaming.
Yes. And I just had that hard conversation with a patient today and she's like, I'm just so desperate to lose weight, but we weren't there yet. I'm like, if you need a GLP-1 agonist, if we're at the end of the road and you need it for 3 months, then we can talk about it. But it's not an easy fix. It's better to have habits. A lot of these patients that are really desperate to lose the weight, which is good because less weight, less inflammation, less cardiac disease. But I usually put a continuous glucose monitor on them and we watch and we do the work and I give them tips. I love that tip. I might actually start telling my patients about the chia seed tip because that's going to fill your stomach with fiber and hold a little bit of water there. So yes, you're not going to jump right for the desserts right when you get there. So it's going to give a little more self-control.
Too full, you got to be a little mindful and you might actually say, I don't really feel like eating it. Yeah, I do want to give a shout out. I'm sure you've covered one of the basic labs I do in my clinic is some sort of a selenium test. Truly, I don't see too many people. Selenium, an important mineral in glutathione production, but very important in thyroid function. I actually see more people with according to the blood test, a bit of an excess selenium level in their blood. But I pay attention to that. I pay attention to it in my plant-based eaters. A lot of them eat a couple Brazil nuts a week because Brazil nuts from a natural source are super high in selenium. The multivitamin I take, again, has not just iodine, but has I think it's 200 micrograms a day of selenium, which is pretty typical. The vitamin-based dose. You don't want to overdo it, but if you're suffering some thyroid condition, if you're on a plant-based diet, you might just ask your doc, can we get a blood selenium, selenium level, and might benefit you to, supplement a little bit either with foods rich in selenium or a multivitamin that has a small amount in it.
Yes, absolutely. So, Dr. Kahn, when someone goes to their cardiologist, let's kind of wrap up this, they should be getting a thyroid test, right, of some sort, or what do they say when they go in? Like, how can we help them out here to get what they need?
The reality is, in standard practice, drawing blood is a pain. There's no income in it. I hate to say that. It takes time. When you get the labs back, it takes more time. You know that. You see that. I spend a tenth of my life doing nothing but looking at labs and emailing patients and giving them feedback, sending them the results, sending the results to their other docs to be a team player. So they probably aren't going to get any labs, but would it be a good idea? And more likely their primary care provider is going to be more open-minded. I mean, fortunately, there are some labs out there like ULTA, ULTA, and Life Extension, where unfortunately you may have to pay for them. They try and make it reasonably priced. You can pick a pretty comprehensive panel of labs on your own. If you're struggling, maybe your doctor doesn't want to do your iodine level or your selenium level or various other things that I talk about, you talk about. So people that are proactive, without completely blowing the mortgage, can pick their own labs and get them. But, from a cardiology standpoint, you want, obviously, at a minimum, a fasting cholesterol panel. There is a more advanced version, but at least get that. I want everybody to get a blood test called lipoprotein a inherited cholesterol that can destroy your arteries and you have no clue. And it's 20 to 25% of the population. So it's extremely common. I like to see your high sensitivity C-reactive protein. It's always, for 20 years plus, been an important measure of inflammation, but some brand new data says it's even more important than we thought. Like to see your omega-3 blood test. That's nothing a primary care doc usually draws, but if you don't have adequate omega-3 from your diet or supplements, your thyroid, your brain, your heart, your cholesterol, your joints, your eyes are all suffering, and particularly your brain. Oh, I don't mind a homocysteine level and a vitamin D level and some form of blood sugar, insulin, hemoglobin A1C. But a lot of these labs you can get, there's a new one out there now. I hate to give a name, but I don't have any financial ties, called lifeforce.com, and Tony Robbins is behind it. So it's got to be medically sound. No, but he's got some great advisors, and like $399, you get 40 blood tests, and it's a pretty damn good panel for $399. I've never referred anybody there yet, so I don't know where you go to get your blood drawn. They probably send you the tubes, and you got to figure it out. But with these kind of options, even if your medical team is resisting, you can work around them. Then you just got to find somebody that understands them, like you.
Yeah, and I think that's important, is if your doctor is not ordering it for you, then find a doctor that will, or go out and do it yourself, because these are life-changing labs that we're talking about that you need to know. Like you said, lipoprotein little a. I know when I got mine back and I was like, yeah, I'm good. Cause it's genetic. Like you said, that's a tough one. LDL, triglycerides, those you can really make a big impact with your lifestyle, diet. And if you had an underlying hypothyroidism problem going on, you can really turn those around. Yeah. So, Dr. Kahn, thank you so much for your time and your expertise today. I would love for you to share with how everyone could find you. They can visit you in Detroit. Where else do you hang out with? I love your Instagram.
Thank
I
you.
chuckle a lot.
I'm licensed in about 20 states, so I do a lot of telemedicine: Florida, Georgia, New York, Texas, Ohio, Illinois, Missouri, Maryland, on in Wisconsin, on and on. drjoelkahn.com, drjoelkahn.com. Take you to my podcast, take you to my blogs, take you to my clinic, take you to the 6 books that I've written, and we have a lot of fun. And, I'm more excited about practicing medicine and cardiology than ever, because it's just breakthrough after breakthrough after breakthrough. And it's so much fun being in a small, hands-on, high-touch clinic where I can really implement new technology and new testing, new therapies, and see the results. So it's good to be free bird.
Well, you're doing amazing things. So we
Thank
appreciate it so much. Thank you for being here today.
Thank you so much.
That was such an insightful conversation with Dr. Kahn, a proof that understanding the connections in your body can lead to big changes in your health. If this episode got you thinking, share it with someone who might need this information, and make sure to subscribe to the Integrative Health Podcast with Dr. Jen for more fascinating topics. See you next time and stay well.